My name is Gregory. I work at Sebring International Raceway, which is a subsidiary of NASCAR. Well, my health journey with my heart was not a lot of fun in the start. It was on a Friday evening, and I was having trouble the previous 2 weeks breathing. I would walk 10 feet and be short of breath, and that was just not normal for me. My daughter works with the sheriff's department. She's a dispatcher, so she knows these things, and my wife said, I think you need to go to the hospital. Well, I didn't want to go to the hospital. Well, I didn't have any choice in it. They called an ambulance. So they took me to AdventHealth in Sebring.
So Gregory was really symptomatic. He was really short of breath, fell out of fatigue, which is a very classic presentation of atrial fibrillation, which is the most common arrhythmia in the world. So he also had a pacemaker previously because he had bad conduction, but he was really felt unhealthy, had gained some weight, and really short of breath. So he was really symptomatic.
And my life just, it was horrible because I'm used to being able to go do things, and I couldn't breathe right.
First, I actually ablated his atrial fibrillation because that's really what made him feel short of breath. Then Gregory was on warfarin, and he had a lot of difficulty managing his levels. Most of the time, the indications for WATCHMAN are bleeding or bruising, or that you can't really get appropriate levels for stroke prevention. So I mentioned the WATCHMAN as an option to get him off the warfarin, and he was obviously very excited about that. So a WATCHMAN is actually what's called the left atrial appendage occlusion device, and it's a structural heart procedure which is done under general surgery. We get access in the vein of the groin. We go up to the right side of the heart, and we cross with what's called a transeptal needle into the left atrium where the appendage lies. So we deliver the WATCHMAN through a sheath into the appendage from the right side of the heart to the left. It's a great complementary that they start with us at Sebring. We bring them here to do the actual more complex procedure, but get them to rehabilitate at Sebring. So that it has a very team approach.
I'd like to say thank you. There's a lot of people don't get a second lease on life. I have. I really don't know what the word is I want to say, but how caring they were, and you felt it genuinely. It wasn't just seeing another doctor, but right down to the facilities with the nurses, and the nurses were wonderful.
They have a great center here. All my Sebring patients, all of them, loved their experience here. They rave about how the Tampa lab, the techs, the nurses, the holding nurses, the discharge nursing are extremely kind to them. So they have nothing but praise for this great institution.